Waking up with a damp pillow is a common experience. It can be a bit surprising to find your pillow wet when you wake up in the morning. Many of us have woken up to that telltale wet spot, a sure sign of drooling during sleep. This can happen to anyone, regardless of age or gender. While it might be embarrassing, it's usually harmless. In fact, it can even be a source of amusement when you realize how common it is. Drooling while we sleep is often just our body's natural processes at work. Our muscles relax and sometimes our mouths open slightly, allowing saliva to escape. In fact, it's more common than you might think. Many people experience this and it's nothing to be concerned about. During sleep, our bodies go through various changes and saliva production is one of them. Our bodies are in a state of rest and repair, and drooling is just a part of that process. Understanding these changes can help us see why that little puddle of drool isn't something to lose sleep over. It's a natural part of our sleep cycle and nothing to worry about. Sleep isn't just one long, homogeneous state, it's a dynamic process. Instead, it cycles through different stages, each with unique characteristics and functions. These stages are broadly categorized as REM, or rapid eye movement, and non-REM sleep. Non-REM sleep further divides into three stages: N1, N2, and N3, with N3 being the deepest sleep stage. As we progress through these stages, our muscle activity, brain waves, and even saliva production fluctuate. Understanding this sleep cycle is key to understanding why we sometimes wake up with a damp pillow. Our mouth, like the rest of our body, relaxes significantly during sleep. This relaxation is especially pronounced during deeper sleep stages, like N3 and REM sleep. During these stages, the muscles that control our mouth, tongue, and even our swallowing reflex become much less active. This relaxation is essential for achieving truly restful sleep. However, it can also lead to a slight drool escape, especially if you sleep on your side, allowing gravity to lend a helping hand. Saliva plays a vital role in our oral health. It's often overlooked, but its importance cannot be overstated. It helps with digestion by breaking down food, protects our teeth from decay, and keeps our mouth lubricated, making it easier to speak and swallow. While we produce less saliva during sleep, sometimes production doesn't slow down as much as it should. This can lead to drooling, which many find embarrassing. This can be due to various factors, including lifestyle choices and health conditions. Sleeping position. Sleeping on your side can make it easier for saliva to escape. This is a common cause of drooling during sleep. Medications. Some medications list increased saliva production as a side effect. This is particularly true for certain types of drugs, such as those used to treat mental health conditions. Medical conditions. Certain medical conditions like acid reflux or neurological disorders can also lead to excessive saliva production. It's important to be aware of these potential causes. Usually, this overproduction is nothing to be concerned about. It's a natural response of the body and often resolves on its own. However, if you're concerned about excessive drooling, it's always best to consult a healthcare professional. They can provide guidance and, if necessary, treatment options to help manage the condition. While drooling is usually benign, excessive drooling, especially when coupled with other symptoms, can sometimes indicate an underlying health issue. These could include a variety of conditions that might require medical attention. It's important to be aware of these potential issues so you can take appropriate action if needed. Sleep apnea. This serious sleep disorder can cause pauses in breathing during sleep, leading to increased drooling. Sleep apnea is often accompanied by loud snoring and can result in poor sleep quality, leaving you feeling tired during the day. If you suspect sleep apnea, a sleep study might be necessary to diagnose and treat the condition effectively. Allergies or sinus infections. Nasal congestion can make it difficult to breathe through the nose, forcing mouth breathing and potential drooling. Allergies can be seasonal or triggered by specific allergens, while sinus infections might require antibiotics or other treatments to clear up. Managing these conditions can help reduce drooling. Gastrointestinal issues. In some cases, excessive drooling can be a symptom of gastrointestinal problems. Conditions like acid reflux or GERD can cause increased saliva production. Consulting a gastroenterologist can help diagnose and manage these issues, potentially reducing drooling as a result. If you're worried about the amount you're drooling, or if it's accompanied by other symptoms like snoring, daytime sleepiness, or difficulty breathing, it's crucial to seek medical advice. A healthcare professional can help determine the underlying cause and recommend appropriate treatments or lifestyle changes to improve your sleep quality and overall health. While waking up to a wet pillow might not be the most pleasant experience, understanding the science behind it can help us realize that, in most cases, it's nothing to worry about. Simple changes like adjusting your sleep position or using a different pillow can sometimes make a big difference. Our bodies are complex machines, and drooling during sleep is just one of the many fascinating ways they function. By paying attention to our bodies and seeking medical advice when necessary, we can ensure that we stay healthy and well rested.